Good morning, everybody. My name is Talita OSA, and I am a respiratory therapist from Fleetwell Medical in Windhoek. I'm so sorry that I could not attend your wonderful wellness day today, but because of unforeseen circumstances, I just cannot be there. But therefore, I would like still to share some information that I think that a lot of people don't know a lot about obstructive sleep apnea. So, did you know that many people stop breathing hundreds of times during the night and they don't even realize it? So, that is called obstructive sleep apnea. And that is breathing repeatedly stops when you sleep, and that is caused by an airway that is blocked. All right. So, it is not about bad snoring, it can seriously impact your health. And globally, hundreds of millions of people are affected but are undiagnosed. So, what happens while you sleep? The throat muscles actually relaxes, and then your airway gets blocked. And then there is certain a few times, a minute or two or few seconds, that there's no oxygen going through, just in simple terms so that you understand. And that is called an apnea. And when that happens, the oxygen cannot go through to your lungs and to the rest of your body. And that causes sometimes, some of the patients has that you will get headaches in the mornings, or you will have heart palpitations, or you will have high blood pressure. And that is because of the low saturation levels that occurs in your body during a night's sleep when you have an obstructive um, airway. Now, what happens to your body in the morning, you will feel tired. You're always tired and you don't have any energy, and you feel you have a headache later in the day, or you stand up with a headache, and then you are sleepy during late afternoons, or you fall asleep while watching television or while driving, and that is serious. Okay, that cannot be overlooked. So if you have any of these symptoms of high blood pressure, or headaches, or constantly tiredness, or your concentration levels is not very good, you struggle to concentrate, you've got no energy, you also have heartburn and you feel depressed, and sometimes also some patients has diabetes, or they have gout, or they have cholesterol and shortness of breath, or they have also cardiovascular problems. Sleep apnea that is not being treated can eventually escalate into a stroke, or a heart failure, or a pulmonary embolism, which is very, very serious. All right, who is at risk? So, common risk factors are being overweight or obese. Now, what happens to your body is, because you don't go into a deep sleep, your body cannot switch off and relax, because it's constantly in stress, because it knows that there's some time, or at any moment, I am not going to get enough oxygen. So my body doesn't go into my REM sleep and my deep sleep. So now my organs and my metabolism don't have time to reset themselves for the next day. Now I get a very, very slow metabolism, and people are struggling to lose weight, and that causes then weight gain and obesity. Okay. And then also ages, it's more than over 40. If you're 40 years and older, you can be more at risk. Females more into the menopause tends to get obstructive sleep apnea as well, but I had very young patients as well, that is as old as 8 years old, that had obstructive sleep apnea. We also look at large neck sizes, which you can find with somebody that has a very short neck and their jaw is very backwards. They also tend to have obstructive sleep apnea. And then also family history. You need to find out if my mother or my grandma or my sister or my brother, do they snore? Do they struggle with sleep? Um, then you can know it can also be genetic. Okay. And then smoking, alcohol use, and nasal congestion can also um, be a cause of obstructive sleep apnea. So it can affect anyone, okay, including children or slim people. So, how is obstructive sleep apnea being diagnosed? First of all, you go to your general practitioner and he's going to complete a questionnaire that we call the stop bang questionnaire. All right, that is snoring, tiredness, also observed apnea, etc. That he's going to ask you certain questions. And then we will refer you to the institution like Sleepwell Medical, and we will do then a clinical study. This study is done at home. So we make it as much comfortable for the patient because we want him to have a good night's rest and not feeling comfortable in an area where he's not used to sleep every night. Okay, so we will attach a device to his body, which is a big watch around his wrist and a belt around his waist, and then a nasal cannula in your nose, and you will sleep at home. The next morning, you remove everything and you bring it back to us. And then I will download the data and I will look at what happened to you during the night. So if you do suspect obstructive sleep apnea, go and talk to your doctor because it's really easy to screen. Now, what happens when we have detected obstructive sleep apnea? We will phone you and then we will make another appointment. And you come in and we will put you then on a CPAP for one night. Now, what is a CPAP? That is a machine that blows continuous positive airway pressure in your upper airway, which will keep the airway open the whole night so that no obstruction take place. And then your body will get sufficient oxygen and your body can start to relax and you can go into deep sleep because he knows I'm going to get sufficient oxygen for the night. The next morning, you're going to wake up and you're going to feel refreshed, you're going to have energy. Later on, if you have high blood pressure, you can get off your medication of high blood pressure, your sugar levels can be more controlled, and also you are also going to feel mentally a lot better, not so depressed, and you can start to do things with your family and for yourself as well, which you had just no energy doing. And then we will um, go to the medical aid and we will get authorization for a CPAP for you as well, and so that you can go on treatment. Sleep apnea that is not being treated will get worse. So at the end of the day, you can end up in hospital with a cardiovascular problem or a stroke, as I mentioned earlier. It's worth it to check it out because it is life changing. Once you are on treatment, you will see that your life has changed tremendously. And we're also looking at longevity because that will also have a great impact on your body as well. So, so how do you get tested? As I said, you go to your medical practitioner, you will give you a referral letter from Sleepwell Medical, and you can phone us, we will make an appointment. I am at the coast once a month for a week where I will then perform sleep studies. So we can just make an appointment and we take it from there. I will also send a report to the doctors so that he also knows what is going on. Thank you so much for your time and listening to me. I've also sent a questionnaire that is going to be emailed to you, and please complete it and email it back to me. Please go and visit our table. Chris Marie is there to assist you, give you flyers and business cards, and show you the devices that I just talked about. And then please get in contact with me. Take care and take care of yourself and your health. Thank you.